Mr. Rogers. My name is Sarah. I'll be your student nurse today. I'll give you some privacy. My patient is nonverbal, so I'm going to look at his wristband. His name is Walter Rogers. His birthday is 10/10/1920. Mr. Rogers, you just seem a little agitated, sound a little raspy. Your respiratory rate is a little low at about 10 breaths per minute, which we like to see it at about 12 to 20. And your heart rate is a little high at about 110 per minute, which we like to see that's between 60 and 100. I'm going to check your pulse ox, see where that's at. And you're at about a 94, which we like to see it up at about 98. So we're going to go ahead and do some trach suction, Dean, and what we're going to do is I'm going to put a catheter down your trach and suction it out. Going to put this cloth on you, and if you can do a few coughs for me, that would be great. And if you cough throughout the procedure, if you feel like you need to cough, that's fine. That'll actually help with the procedure a lot. I'm going to turn your oxygen level up about 100% of what it's at. So I'm going to hyperoxygenate you. If you can take a few deep breaths for me, that would be great. Turn on the suction. Check that right next to you. Trying to open up my field here. Since I've used this saline before, I'm going to whip it a little bit into the trash bin, and then put some into my basin here, and replace the top. I'm going to touch only the outside of my sterile field. The inch around is non-sterile, so I can touch that with my hands. My right hand is going to be my dominant hand. And will be my sterile hand. I'm going to attach this to the suction. I'm going to suction a little bit of saline and check that my pressure, my millimeters per mercury, is correct between 100 and 200. Okay, Mr. Rogers, I'm going to take your oxygen down. I'm going to insert catheter into the trach until I feel resistance, and then I'm going to suction and rotate permanently all the way up. Go ahead and take some deep breaths. I'm going to wait 30 seconds before I do it again, and I'm going to clean out my catheter. Mr. Roger, I'm going to have you take another deep breath. I'm going to take your oxygen off. I'm going to place the catheter in again until I feel resistance, and suction and rotate on my way out. Replace this oxygen. I'm going to check Mr. Rogers' pulse ox. It is now at 98, which is great, in the range of normal, and sounds less raspy. He looks less agitated. Mr. Rogers, can you breathe better? Good. I'm going to discard. Keep my saline out. Rogers, I'm going to go ahead and do some oral care for you, just because we have a lot of secretions that got into your mouth with all that coughing you did, which was really great. It helped a lot during our procedure. I'm going to dip this into water. I'm just going to go ahead and clean out your mouth from the bottom and then from the top and get all that gunk out for you. Okay, and now Mr. Rogers, I'm also going to clean your trach area for you.